So why don't you start by introducing yourself, your title, and your company?
Sure, absolutely. First of all, thank you for inviting me to this interview. Ryan Delarami, I'm the founder and CEO of TeleVU. TeleVU is a startup company based in Toronto, Ontario, and we're focused on building an ecosystem of connected care for connecting physicians to their peers, whether it's for training purposes or clinical applications.
That's great.
Yeah.
So have you been to a HITLAB summit before, or is this your first one?
Virtually, yes. This is
Virtually,
my
okay.
first in person, yes.
Okay, and how do you like it so far? What's your impression?
So far, so good, other than the flight challenges I had.
Oh.
But I'm here, which is good.
Well, that's
Yeah.
great. We're happy that you're here.
Thank you.
So is there anything that you're looking forward to in particular for the summit? A particular speaker, a topic that you want to hear discussed?
Absolutely. I think it's important to hear other people's sort of take on digital health, because sometimes we kind of live in our own bubble thinking about our own technology. So it's great to see different aspects of various technologies in use, and also thought leaders, whether they're CEOs of the companies or hospitals or other people in this as a key opinion leader. So I think that brings a different element to it.
That's great. So you mentioned that TeleVU works to keep physicians in contact with each other and facilitate that communication. How do you think that's going to impact both digital health, that field, and also medical education?
Absolutely. So TeleVU, as the name suggests, you view from afar. So essentially what we're doing, we're bringing the element of, or removing the geographical barriers of care. So think of it as education. We're currently present in 12 African countries where surgeons in those countries are receiving training remotely by their peers in various hospitals such as Cedars-Sinai or Boston Children or Stiff Hospital in Toronto, so you name it. So this provides a mentorship sort of capacity for those learners, if you will. If you look at it from a clinical perspective, there are often times that you need to consult with your peer on certain cases, or whether it's a procedure or a patient, whatever the case may be. So this also provides another element of integrated care, which because of our augmented reality and AI sort of element, it brings a new level of sort of interaction. So it's not just audio video, it's much more than that. So we make it as immersive and as interactive as possible, as if you were there. One of our sort of users has a good term for that. It says this virtual shoulder to shoulder, which is, I think to me, it's a great term.
Yeah, that's great. So your platform allows for people in all parts of the world to communicate with each other.
Yeah.
What do you think this says about accessibility and digital health in general?
Yeah, absolutely. The main reason we designed this was around that aspect of it. Like, how do we make sort of care available? I'll give you an example. In Canada, 97% of our specialists live in 12 municipalities. And which says a lot. Like you go outside those, there are several hundreds, even thousands of other municipalities which only have access to a small portion of them. So if they need specialists, what do? They have to travel. And some other communities don't even have access to primary care providers. So we've heard about ER closures around the globe. So these are all different aspects of access to care. So somebody lives in a certain zip code, they have access to all sorts of care and specialties, but if you go further away, it all evaporates. So this is kind of the element that we want to bring back into care, which is doesn't matter where you live, there is a platform that allows you to communicate with others in a more meaningful way. So it's all under a sort of a secure environment that is important in healthcare. And we respect the privacy of the patients and the providers. We utilize AI to sort of enhance those, such as facial blurring if you're in a video, or removing the name of the patient from an x-ray, or things like that. So simple things that go a long way when it comes to digital health.
Yeah, that's great. So what do you think are some of the gaps in digital health that need to be filled, either in terms of accessibility or in general? And how do you think TeleVU or other companies that you see here are addressing that?
Yeah, I think the biggest gap is connectivity.
Yeah.
So if you, again, back to my point about your zip code, certain zip codes have access to internet, access to technology. So if you're living in those areas, you have no problem.
Right.
You go further away, go to some of these African countries, or even in Canada, some of the northern communities, they won't have good access to high-speed internet. And a lot of these digital health platforms are relying on those type of bandwidths to deliver the care that in a digital form. So I think that would be the biggest sort of area. The other sort of element, I think, is mostly around, and one of the speakers also talked about this, is about digital literacy. Like, people who are using the platform have to be comfortable using the technology.
Right.
And to that point, it's very important for innovators to make their platforms and make their solutions really easy to use. And being sort of simple is an art. You have to be very sort of complex in the outcome, but simple in the form of delivery. I think that would be a key element of adopting digital technology. So it has to be simple, and it has to be available on a broadband.
Yeah, those are great points.
Yeah.
Well, thank you so much for
Absolutely.
answering my questions and joining
My
me. It was a
pleasure.
pleasure.
Thank you.
It was great hearing about your company, and I wish you the best of luck and a great rest of your summit.
Thank you so much.
All right.
Pleasure.
Thank you.